An important concept that has been followed for several years now with radiation therapy is called boost treatments. Why is this concept important? Well, in lumpectomy or partial mastectomy, if we're going to have a recurrence in the breast, then 85, perhaps 90% of the time, the recurrence will actually occur right in the same neighborhood where the original cancer was. So the concept that emerged then was, well, if that's the case, let's go ahead and add some extra radiation therapy right just where the cancer was, which was one of the reasons why the surgeons always left clips to mark where they were in the breast. And so the concept, or the term used here, is called boost. And certainly over the past many years, the way the boost has traditionally been done is that at the end of 5 weeks of radiating the whole breast, the last week or more would be, quote, boosting the area where the cancer was. And this was done, again, with electrons as a wonderful energy source done in a vault. The electrons have to travel through the skin in order to get to the target area as well as the fatty tissue underneath. One of the disadvantages of this is not only damaging the overlying skin and subcutaneous fat, but the radiation oncologists were always worried whether they were actually hitting the target. In other words, they were worried about a miss. In other words, not fully getting the area. So therefore, for those, particularly in Europe, and some of my distinguished colleagues from Salzburg, Austria, I got the concept, well, wait a minute, we have a linear accelerator operating room. Why don't we start doing the boost therapy at the time of doing the lumpectomy? And they began this over a decade ago and have accumulated some absolutely fantastic data. And this approach now has spread to other areas within Europe. What's the advantage of doing the boost at the time of the lumpectomy? Well, the surgeon is right there. The surgeon literally sees where the target is. The surgeon knows where he or she took the cancer out. And therefore, when you put the cone in to help guide the radiation therapy, you are literally right on top of the tissue that's at risk, where there could be little microscopic cancer cells left behind. The other advantage of this is that you're not damaging the overlying skin and subcutaneous fat tissue because it's pulled out of the way. So there's going to be more and more use, certainly in Europe, and I believe more here in the United States, of doing the boost therapy in patients who need whole breast radiation therapy at the time of doing the surgery. In other words, using IORT as a very effective way of delivering a very accurate boost. The Mobitron is a mobile, self-shielding linear accelerator used to deliver intraoperative electron radiation therapy for the treatment of breast and other forms of cancer. To learn more about this exciting and cutting-edge technology, please go to intraoperativemedical.com.